I'm Dr. Amritaksha Deb. I am a nephrologist and practice in Kolkata. Today we'll be talking about a very sad aspect of kidney disease, and that is the fact that chronic kidney disease is by nature progressive. We should firstly understand why it is progressive. The reason that it is progressive is that even normal people after the age of 40 years have gradual loss of renal functions. We have a normal GFR of around 120 ml per minute. Over time, it gradually decreases. Usually after the age of 40 years, we lose around 0.7 to 1 ml of GFR every year of life. So a 80-year-old will very frequently be found to have just 60% of renal functions that are preserved. Now, due to any particular disease, if we lose a part of the kidney function, then the loss is exaggerated. We also find that chronic kidney disease is present in large number of diabetics who have protein which is excreted in urine. Proteinuria causes the rate of loss to increase to up to 5 to 10 ml per year instead of the normal 1 ml per year. Another fact is that we are born with our nephron supply. We are born with the glomeruli. Due to any reason, if we lose more than 50% of our glomeruli, then the rest of the 50% will have to work for the whole body. And so disease begets disease and the progression keeps going on. Now, what do we do to prevent the progression of the disease? That is an important question. And as we know there is progression, how do we plan for it? So firstly, let's talk about planning. When we find that our kidney functions are declining and we expect our kidney function to decline to less than 15 ml GFR, that is considered as chronic kidney disease stage 5, in the next 1 year or so, we are to plan about the renal replacement therapy that we are likely to need. Renal replacement therapy can be of 3 forms. One, hemodialysis, that is the simple blood dialysis that we do. Second would be peritoneal dialysis, in which a catheter is placed inside the peritoneal cavity, the abdominal cavity, and we can do dialysis through it. And third would be a renal transplant. So we have to plan these so that unplanned dialysis or unplanned renal replacement therapy need not be done, sparing us from a lot of trouble. The other issue is preventing the progression. For preventing the progression, we should know that in top of the general progression, there are other factors which cause acute and chronic kidney disease. These factors can be infection, dehydration, or taking certain medications which can damage our kidneys. So we are to avoid doing this. We are to avoid acute kidney disease, and we are to manage the basic pathology that has resulted in the chronic kidney disease as best as possible. We are to maintain a milieu that is appropriate for the body, and these can be done with the help of certain medicines, and that basically will help in preventing the progression or preventing too rapid a progression. The progression will be there, but it won't be as rapid if we do not manage it. That's all. Thank you.